sound to me like an utterly done deal. And there's been a lot of talk tonight about, well, we ought to do this, we ought to do that, let's consider this, and let's consider that. It seems useless.
Right.
What kind of input on this done deal can we as citizens possibly have? I want specifics. To whom do we speak? Do we have any effect whatsoever on this done deal?
Well, I'm going to answer that. We still have to fund it. It still has to come back to get funded. It has to be appropriated. It has to have a methodology for raising the revenues. That's where it could be stopped.
Besides the language that was in the initial House bill that said that it couldn't be implemented until 90 days after the legislature had produced a financing plan and a waiver had been granted by the federal government, the additional language that we put in the Senate requires that they can't put it in if it's a less than policy, so it has to have that actuarial value. They can't put it in if the financing isn't sustainable. They can't put it in if reimbursement to providers isn't at a level sufficient to attract and retain high-quality professionals, keyword there being high quality. They can't put it in unless there's demonstrated administrative simplifications and savings. And they can't put it in unless the cost containment efforts can be shown to bend the cost curve on spending per capita by people in the state of Vermont for health care. So those are all conditions that have to be met prior to Green Mountain Care ever being implemented.
But who makes the decision that these things,
The board.
The board. So then my question stands, what do we as citizens, what can we as citizens, what kind of input can we possibly have when it's a board appointed by a governor that's going to be making those determinations?
And Senator Mullen is right that every time you go to the polls and decide who you're going to vote for, you are having your accountability moment and you are deciding who's going to be making the decisions. Because the legislature can't go back and change this bill next year because you can't go back over the same thing during one biennium. But things will change in the future, and I think we all need to work together to try to be sure that something good comes out of this process. And I think you will have input even to the board and through your legislators. But I don't at all discount your concern because I share it.
If I were a concerned citizen, I would be urging, even though we don't have public referendum, I would be urging a statewide petition to change the report date from the Green Mountain Care Board from January 2013 to September 2012.
Yeah.